Welcome to another video of Anatomy and Physiology. In this video I'm going to be highlighting the shoulder or the rotator cuff. Along with the rotator cuff I will be highlighting some of the complementary muscles that go along with it. But let's first talk about the rotator cuff. Okay, you might hear this term called out quite a bit in sports, where usually it's with a major league pitcher who has torn a rotator cuff muscle or tendon. Um, these are the muscles that they're usually talking about when they speak of the rotator cuff. Okay, so the first one would be the supraspinatus, your infraspinatus, teres minor, and then let me zoom in a little bit, your subscapularis. So as I talk about these, I want to highlight a bit where these muscles are actually attached. So I'm going to hide these, and I'm going to reveal the scapula. So two major features of the scapula that I want to highlight. Number one is right here. Okay, this is the spine of the scapula. Okay, and this area here is the superior portion of that, or the superior side of the scapula. Now this actually has a specific name. Okay, the superior fossa of the scapula, and then you have the inferior portion of the scapula, which coincides with where the muscles attach, the supraspinatus, which is supra meaning above the spine of the scapula, and then you have your infraspinatus, which is the area below below the spinatus of the spine. Sorry. So as I rotate to the anterior portion of the clavicle, this whole area, this anterior portion of the scapula is called the subscapularis, which is where the subscapularis muscle is attached. Okay, so now that we have these regions identified, let's go back and actually refresh this view, and again hide these. That's my deltoids, which I'll speak of later. So again, just to review, this is my infraspinatus, below the spine of the scapula, supraspinatus, teres minor, and then on the anterior portion, the subscapularis. So these are the four muscles that comprise your rotator cuff. Okay? Now one thing I want you to pay attention to as well as I show you, whoops, let me hide these guys. As I show you your humerus, okay, note how these muscles are responsible for keeping the humerus attached into what's called the glenoid cavity of the scapula. Okay, and this is a ball and socket joint. Okay, and these muscles are attached to the head of the humerus. So let me actually hide these so you can actually see the glenoid cavity, which is where the head of the humerus will go in. Okay, let me hide these ligaments. So usually these ligaments will tear. Now there's different severities of tear. You can have a partial tear, or you can have a complete tear where the muscle is basically broken into, or the ligaments broken into. So this little area right here is called the glenoid cavity. That's where the ball of the humerus will attach, and of course those muscles keep them in place. Okay. One other thing to note is that the supraspinatus is most commonly the muscle that will have a tear. Now you can have tears in other locations, but this is the most commonplace location for a torn rotator cuff. Okay, so now that we've identified our rotator cuff muscles, let's look at some of the complementary stabilizing muscles of the shoulder girdle. Okay, let's first take a look at the large Latissimus Dorsi. Let me back up a little bit so you can get a better view. Okay, so the Latissimus dorsi covers the bottom half of the thoracic cavity and down to your lumbar region. Okay, so these are the posterior muscles of the shoulder girdle. It's a very thin sheet, and it's a large sheet, as you can see. And then just below the teres minor muscle, we have our teres major. Okay. And as I rotate to the anterior portion of the body, here's our pectoralis major. So these are all muscles that aid in stabilizing the shoulder girdle. Okay, and these all keep the humerus, the ball of the humerus, in place, connected with the glenoid cavity of the scapula. Okay, and then you can see this muscle here. Okay, this is your coracobrachialis. Okay, once again, another one of the stabilizing muscles of the shoulder girdle. So let's take a look here on the opposite end, this side of the shoulder, to the muscles that I moved earlier. This is called your deltoid. Your deltoid has three bellies. The anterior portion of the deltoid is the anterior head of the deltoid. Okay, and as I look on the lateral end there, I have the middle head of the deltoid. And then rotating posterior, I have the posterior head of the deltoid. So these are all muscles of the shoulder girdle, and rotator cuff. These keep the humerus in place, and you use these all the time. If you ever played baseball, if you've played football, any sport that involves you throwing an object, these are the muscles that you undoubtedly feel after a long day of practice or a game. Okay, so good luck in your studying.